Hi, good morning, everybody. This is Yehuda Shamroth. Don't be confused. I usually do Wednesdays. It's actually called Wellness Wednesdays health program, but today is Tuesday, April 20th, and I had to move it up a day to accommodate some schedules. So thank you for joining me a day early. I will post this on my Facebook group and Rabat Beit Shemesh Acupuncture Facebook group, RBS Acupuncture. Also, I'll post it on my personal page, and here you can watch it on the YouTube replays also. And I'm from Ramat Beit Shemesh, Israel. I'm a nurse that became a Chinese medicine practitioner. A lot of about 30 years of nurse anesthesia experience, combined with almost 10 years of Chinese medicine learning and experience and practice. And I consider myself a wellness coach, an integrative medicine practitioner, a liaison between the medical community and the alternative community, because I'm really a firm believer, and it's true. I believe that it's easy to integrate both regular Western medicine and also the newer, what we consider the Chinese, old Chinese methods. We didn't really consider too much seriously, but now, of course, they're becoming more in favor. Alternative medicines like Chinese medicine, acupuncture, herbal medicine, and everything alternative that goes under the alternative categories like massage and Reiki and meditations and all those things that have really been around for 1,000 years, but or more. But now they're becoming much more acceptable to Western society. People are looking for answers. People are looking for ways to cure their chronic illnesses, and they're not getting answered sometimes with the regular Western abilities of regular Western methodologies. Excuse me. So I found that way myself. I was not always a Earth Mother type, making organic food for my kids and eating just natural stuff all the time. I really was just a regular nurse who learned anesthesia, and in taking care of my patients, I noticed so many of them had chronic illnesses. They didn't know who to turn to, because I'd say to them, "Well, what is your doctor telling you about what to do for your irritable bowel or your dry eye syndrome or whatever, headache, chronic migraines, insomnia, you name it, back pain, everything?" And they'd say, "My doctor just told me to go home and live with it," which really broke my heart and also made me angry at the same time, because I felt there's got to be something more we can offer these people. So as I was learning about what to recommend to people, I discovered this whole world of alternative medicine, which I now call integrative medicine, and it's very popular all over the world, and it's the wave of the future, and it's the way it should be. So having said that, if you want to see these videos and you want to give me some more suggestions on topics, we've discussed many topics already. I've been going through this at least almost a year now, I think, all through Corona. And we talked about everything from inflammatory bowel disease to GI health to emotional health to pain and trauma to emotional freedom techniques, herbal medicines. We've discussed so many topics. So today's topic is very exciting to me because it's another way of melding Western and Eastern philosophies together and making them blend very nicely. And that is how to look for a physician or a practitioner of some sort to help you get on your wellness journey. People are much more aware now that they have to do something to take care of themselves. I think Corona really woke us up. I think it said to us, to me, to everyone, you better live your life much more healthily now, because something like a wave of COVID-19 could come your way. And the people who were in pretty good shape and took their supplements and vitamins and exercised regularly and went to bed early and drank a lot of water, all the things your mother told you to do, they did all this, and I think they fared going through Corona much easier than people who had very poor condition health. And we know that people who are obese and people who are elderly, people who had pre-existing conditions didn't do so well, by and large. And some people did. Again, one thing we did learn about Corona is that we didn't know that much about it, and we still don't. But anyway, getting back to our topic, we have a special guest today, Dr. Simko Shapiro, who's a very good friend of mine, and he is a physician here in Ramat Beit Shemesh, Israel. And I will read about his bio a little bit later when he joins us. But I just want to review a little bit about, I want to ask him his opinion about how you should get involved to take care of your own health. That's the whole point. I'm going to give you my opinion and my personal view of how we should get busy taking care of our own health and paying attention to what we're doing, and not just letting people tell us what to do. I'm a firm believer that the medical community is strong and wonderful still, and it does wonderful services for us. I'm part of that medical community, so I'd never put it down. But there comes a time when we have to take responsibility for our own health, and that's sort of what this is about. I want everybody to think about the fact that it's really your body, and not that no one should tell you what to do. No, that's not what I'm saying. I'm saying you need to get all the information you can get. See what is the best way to take care of your health, because it's your body and you need to take care of it. And no one else should have to tell you to quit smoking, and no one else should have to tell you to give vaccines if that's important. I don't know. I'm not going to start a big discussion, but no one should have to tell you to eat, stop eating junk food and stop smoking, stop drinking. Why should somebody have to tap you on the shoulder and say, okay, now that you've damaged yourself, we're going to take such good care of you? I don't know. Is that really fair? Is that really fair to the finances of the country that you're living in? Is it really fair to the medical community? I don't know. But, this is, of course, ethics and opinions are all different. But there are basic tenets that say now, especially now more than ever, we have to take responsibility for our own health care. Okay. And if you're interested in optimizing your health and finding a doctor who's willing to help you to get there are questions you should ask. And there are things you should know that should prove valuable in finding the right person. It doesn't have to be a doctor either. It could be a nurse like me. I'm a very highly trained nurse. I'm a nurse specialist, and I have a nurse practitioner degree as well as my anesthesia degree. Health coaches are wonderful. There are nutritionists you can go to. You don't have to only go to a physician, but you do need a physician for important medical problems. If you have hypertension, diabetes, thyroid disease, anemia, asthma, you have to go to a doctor, and you should respect that doctor very, very much. So you need to have a doctor in the picture. Also, if you want to have blood tests taken, you can have your routine tests taken, but they don't always show you the whole picture. So sometimes we need much more specialized blood tests to tell us if you have inflammatory markers, if you have markers meaning like if you're a setup, if you're a predisposition for diabetes, thyroid disease, Hashimoto's thyroiditis, all these things are unusual autoimmune conditions that we're finding these days with highly inflammatory as a basis. We need to take further testing. We have to take stool testing. We have to take breathing testing for trying to think of Helicobacter. It's a breath test. There's all these different tests you have to take. Sputum tests. They can send away to different countries. They don't always do them in your country. So you have to be aware of these tests. So sometimes your doctor's a busy person too, and they don't have time to spend an hour and a half with you to see what is it that you're eating and how are you feeling. It's too bad that they don't. It's too bad that they can't. But this is what the intermediate practitioner is good for. We're always called ourselves physician extenders, and I really am very proud of that title. Okay, so we want to go back a little bit about the history of expectations of physicians and patients. And I'm just going to go do a quick slideshow here. I don't have Live Studio. Why am I leaving to share my screen? Okay, I'm going to share my screen. The most important thing to know is that you can choose. You can choose what your healthcare is going to be like. It wasn't always like that. Remember, in the early days, the patient, what the doctor said was law. Okay, and you didn't have any right to question it. And so much is spoken and written about this the way it used to be through the years. And now it's evolved into a place where patients have much more responsibility in the medical setting. So there's not very much literature on this subject, but patients now are expected to be well informed and have some autonomy in their decision making. And it is with their increased autonomy, there's a need to highlight that yes, you are responsible for yourself. And a patient-physician relationship is built on a good communication. Or I don't have to say again, you don't have to have a physician, but you have to know that there's a physician that you can trust and go to if you do need something. And they're very happy to relinquish some of their control. They're not control freaks. They're very happy to have someone like me spend a lot of time with their patients and go over all the medications and make sure they're not taking doubles and making sure that they're getting their tests done on time and making sure that they're renewing their medications. Most physicians I know, especially in the family practice setting, are very, very happy and very proud of these nurse practitioners who take such wonderful care of their patients. I know my parents love their nurse practitioners. My father died, but my mother, he loved his nurse practitioner. And the paternalism that we used to see, like you don't know anything, we know everything, is really, really dissolving and becoming much more of a partnership. It's said that in the World War II days, there were really derogatory terms for patients who didn't do what you said to do, and they were called non-compliant. They were the non-compliant patient that wouldn't take the medication, that wouldn't have their surgery or something. Those people were really frowned upon in the medical community. And then it evolved to something else, which was we had to change the term non-compliant to the fact that they just were refusing. They were refusing to take the treatment. Well, I don't know what the difference would be, but there are two sides to every story. I was part of that whole era where we would say, "Ugh, why should we bother with this person? Because they're not listening to us anyway, and they're not, obeying what we say. And I never felt I never felt like I played that role while I was above anyone, but I did feel very frustrated by people who you would give a lot of advice to, or you'd spend a lot of time tender loving care, taking care of them, and then they wouldn't take their medications, or they wouldn't show up for their surgery, or they wouldn't show up for any kind of wellness and health visits. And also, I can tell you too, my husband's a physician, and when people come to the house on our Sabbath and interrupt our dinner, and they want to talk to my husband, it's urgent. They'll take him away from our dinner table for a few hours, and he'll give them all his expert advice. He's the kind of person that doesn't tell you what to do. He gives you lots and lots of information, which is the way it should be, and then you are informed to make your own choices. And then the people wouldn't follow his advice anyway, or they wouldn't follow. They would lead to one decision like, yes, you should go to the hospital, or no, you shouldn't take that medication, or something. And it would be very frustrating for us that he would be taken away from the family table for hours, only to find out that people didn't listen to him anyway. So you have to respect a physician for his or her knowledge. And if you're going to take their time, or a nurse, or any kind of healthcare practitioner, just be in mind that they are really highly, highly trained. And if you don't jive with their personality, okay, that's one thing. Maybe they don't have the best bedside manner. That's another thing. But if you don't take away their ability to really make some good suggestions for you. And I know, so I have two brother-in-laws that are dermatologists. They spend about 1 minute with a patient each. They might have to see 50 patients a day, by the way, which I can't get over. I've never had to do that. I never had to, sorry, somebody just interrupted and I was thinking about the message. Okay. Why do they spend one time with the patient? Because they're so highly trained. After 40 years of looking at skin conditions, they can see when you're standing in the doorway what you have. And I'm not joking. Some people are so highly trained. So don't criticize somebody who only spends 5 minutes with you. Maybe that's all they really need. They're not trying to just rake in the dough, because I'm just telling you, if they're working for a healthcare plan, they're having to take care of many, many patients a day. They don't even have time to go to the bathroom. And by the way, they're very highly trained and they know what they're talking about. So give them some consideration. Okay, so anyway, patient responsibilities have been a topic for a long time now, and since the 1970s at least. And here's the AMA on patient responsibility. Okay, you have to be truthful. This is you to the patient, to your practitioner, whether you're a doctor, nurse, or any kind of healthcare provider that you're going to for some assistance on your health journey. Be truthful and express your concerns clearly. Provide as much complete medical history as possible. Don't lie about what you've had. Don't lie if you're a smoker. Don't lie if you smoke marijuana or take certain drugs. Don't not tell that your OBGYN that you have had 2 abortions or something. I mean, it's all confidential. It's not going anywhere. So many laws now for confidentiality anyway, in America especially. And I know I'm speaking to American people as well as Israeli people. So just be honest and be upfront, because it might really have it might really help you with your healthcare journey and help them understand how to take care of you better. And don't forget to tell them that you're allergic to something, or you had a bad experience with a surgery or an anesthetic medication. Please tell every single thing, because we can take care of you better that way. And make sure you can cooperate to the best of your ability on agreed upon treatment plans, and take responsibility to show for your appointments. And take responsibility when you can do it. You can't always prevent things, but try to take responsibility for going to bed earlier, drinking that water, eating those healthy vegetables, not smoking, not drinking. Those are things that no one can do but you. Okay, and consider participating in a medical education by accepting care from medical students and residents if you have to. It's not always optimal, but if you're in a teaching hospital, like I used to work in many times, these people are learning, and try to be a little patient with them and try to help them out and be kind to them, because they're only going to be someone's doctor one day. They might be your doctor one day, or your nurse. Okay, I only put this slide up here because there are different things to consider when you're choosing a practitioner, and it doesn't, again, have to be a doctor, but it might as well be. The doctor can be your basis for everything else, or your springboard for other types of care. Then you can go to your nurse practitioner. Then you can go to your person like me, your wellness coach, and your acupuncturist, Chinese medicine doctor, and we can all work together to take care of you. But just different considerations for different ages. For a pediatrician, you have to make sure you want to prevent disease, maintain health, and monitor the growth. Your approaches could be a real collaboration. That's when you really need to collaborate, is when you've got kids, and you can read down further. You want to know what medical conditions and services are available to you, nutritional services, and so on. Family physician takes care of somebody from birth to 100. I think Dr. Shapiro could tell us a lot about what he does as a family physician. You want to also, all of these are going to be preventative, okay? We want to know all about the conditions and services. Do they provide vaccines or preventative care, injury? Do they deal with emergencies, things like that? And you want to know what their training is on every single level. What is your training? Are you board certified? Are you not board certified? Have you had a lot of experience? And if you have somebody who's not very experienced, at least make sure they went to reputable schools. You can ask them. It's not, they should very much share their information about where they trained. An internist is somebody who's a little more specialized. And if you have like autoimmune diseases, you're going to have to go to somebody. For sure, your physician will refer you to specialists. If not, an internist who will know more about certain diseases have regarding, let's say, the thyroid disease or liver disease, fatty liver, this kind of stuff that we're seeing more these days. And then for older people like me, 60 to 100, make sure you have a lot of preventative care there and emphasize the chronic and acute illnesses. Let's hope that they have a lot of information on that. And they should know about dementia. They should know about services for that, for osteoporosis, for arthritis, for cancer, things that we will see in the older age group. Make sure you go to somebody who's, it doesn't have to be a specialist, but somebody with a broad spectrum knowledge. Okay, you want to be an informed healthcare consumer. So you want to know your provider options, and whatever country you live in, you have to know what your healthcare plan provides for you. You have to know the public policy. What are the laws in your area about treatments? And I can't speak to all countries. It's just too complicated. But we have a semi-socialized healthcare here in Israel, and we have private. So you can do both. It's actually the best of both worlds. We take a lot of taxes out because of that, but everybody has healthcare here. And if you want to have a higher level, let's say, situation, or if you want to be pushed to the front of the line, you can pay privately. We want to know your treatment options. And again, we want to take responsibility for your health, because if you don't take responsibility for your own health, no one will. No one out there, the best doctor and nurse in the whole world, the best acupuncturist in the whole world cannot cure you. If you come to my office and say, I really, really need to lose weight, or I really, really need to feel like my heart isn't pounding out of its chest, okay, you have to get a medical evaluation. I take your blood pressure. I look at your blood tests. I can do a lot for you, but I cannot take you home and go buy the right foods and put them in your refrigerator so that you are a healthy person. I can't walk you around the block so you get that exercise. I can't do it. Only you can. Please take responsibility for your own health. I wonder if doctor's going to join us. Okay. You want to have two main points here. You want to partner with your providers. This is the new wave. It's been like this for quite a while. Don't just wait and sit around and wait till you're ill to go to the doctor. Be a little bit preventative yourself. You want to partner with your providers. Okay. You want to seek help when you need it too, because a lot of people think they can handle everything on their own. I have friends, I won't say who they are. They treat themselves with everything, with their own drugs and their own concoctions. And that's cool. And that's great. And as long as it works for you. Okay. I think it's wonderful. And if it works for you, fantastic. But make sure you have somebody in your back pocket to go to if you have an emergency. Because if you are a person who treats everything on your own, from a common cold to cardiac disease, there's going to come a day when you're really going to have to see a doctor, and you're don't want to go pick somebody out of the phone book. We don't even have phone books anymore, but you know what I mean? It's really better to have an ongoing relationship with somebody first. And then you're going to get much better care, and you're going to get it when you need. And make sure you do seek help when you need it. So don't sit at home with chest pain, and don't sit at home with asthma, and don't sit at home with the glucose like a sky high or blood pressure sky high. Please go check it out. And then you can come back to somebody like me, an alternative healthcare professional, and you'll be on your medications, which I would never dream of touching, and we'll make sure you get healthier from the inside out, like putting you on herbal medicines or getting a lifestyle change coach for you, or getting some acupuncture. We can combine all of these things. It's a wonderful way. It's a wonderful, wonderful way to take control of your health. Dr. Shapiro's in the wings here. I see he's going to be on in a minute. So again, I can't emphasize enough that you have to take responsibility. And the only way to take responsibility for your health is to make sure you have looked into all the things we talked about, look into what your healthcare plan provides, look for the kind of person that you can get along with, somebody you can rely on, someone has a good education, someone has good ideas. Even if, like, I'm a person who I'm very limited in my scope, I'm not a physician, I'm very, very educated and knowledgeable, but I know my limitations. So if I think that you need to see a physician, I'm going to put you in my own car and take you there. If you have skyrocketing blood pressure and you're not taking medications, you have to know that you have to do whatever is necessary for your health. And again, we can always reduce the medications for cholesterol and high blood pressure and things, but you really need to go to your doctor and get proper care to prevent strokes and all kinds of terrible things from happening. But meanwhile, we can come back to somebody like me for health, lifestyle advice and help. But you have to take the responsibility on your own. We know that if you don't maintain a healthy lifestyle, it says here 40% of all premature deaths are due to unhealthy choices. Smoking, poor diet, sedentary lifestyle. I was working in a hospital. The last experience I had working as a nurse anesthetist, I was in shock because I had previously been working the same job. I worked every 4 months. I traveled from Israel to Baltimore. I worked in an ophthalmology clinic, and I saw all kinds of patients there, mostly elderly people, of course, but lots and lots of people with all kinds of illnesses. But then I had to switch to do agency, what they call agency work. And they stuck me in a hospital in the middle of America where people just weren't taking care of themselves. And I was in such shock. I had so many young people to take care of for surgery. I had to take responsibility for putting obese kids to sleep and hope that they do well. And they look at me like, that's your job. Don't you know what you're doing? You would see 19-year-olds that weighed 300 pounds and were smoking and had diabetes. What was that? I never saw that before. I must have been living in a bubble. I really didn't realize that this is where the country of America is headed to some degree. They're spending more and more money on healthcare, and they're becoming fatter and sicker, and I don't really get that. And meanwhile, then it falls to the medical community to take such fantastic care of people, and it's kind of not fair because, you have to take responsibility too. And I did have a lot of conversations with people, with a lot of patients that I took care of and offered them to be their personal health coaches that they can call me in Israel. I actually got into a little bit of trouble over that. One of the doctors didn't like that I was advising people to have preventative medicine, but that's another story. Okay, so the best way to have a healthy lifestyle is something you already know. So make good decisions and get help with your decisions if you're not sure. Get your partner, your husband, your wife, your parent, your family member, even your children. If you're an older person, involve people in your healthcare choices, because the more information you have, the better you're going to be. Okay. And again, here's your healthy lifestyle checklist, which I can send to all of you. You want to maintain a recommended good body weight. You want to eat a plant-based diet to the best of your ability. You don't have to be a vegetarian. We love meat. I eat meat all the time. I just want to say, eat plant-based diet with moderate portions. And then you can eat your meat as a treat. This is what we do now in our family. We eat all the vegetables we can at the table. And then if we're still hungry, we'll have the meat. And we usually have meat just on the weekends anyway. It's just a little healthier. Please try to engage in regular physical activity. You want to prioritize healthy sleep. You don't want to just stay up all night long and sleep 8 hours during the day. That's not very healthy for your circadian rhythms. Try to get a good night's sleep. Go to bed a little bit earlier every night if you can. Try not to smoke or use drugs because it's just so damaging to every single organ system in your body. As you age, it's a lot harder to take care of someone too who's been alcohol dependent. And think about your poor liver is just crying for help. It's just your detox organ of the body. But if you destroy your liver, you don't have a lot of hope of detoxing anything. And we live in a toxic world. We've talked about that so many times. Try to master your stress. Everybody has stress in the world. And if you can't get rid of it, people come to me and say, I need help with stress. And I say, I can't take your stress away. I can't. I really could. But I would if I could. I can help them de-stress while they're with me, and I can give them calming herbs, and I can help do meditations with them. But it really falls on you as an individual and me as an individual to try to look for ways to de-stress your own life, whether it's meditation or just taking a walk or whatever is recommended by your healthcare professional. You try to nurture some strong personal relationships. There's nothing like a good friend to help you through everything. And cultivate healthy personal environments. Set up your environment for success. Get rid of junky foods in the house. Make sure you get off your computer earlier. There's all kinds of things we've talked about multiple times. Just to try to set up a healthy environment. It doesn't come out of thin air. Okay, you've got to work at it, just like anything. And find meaning and purpose in your life. So if you aren't doing anything too good, I saw somebody write on Facebook last night, my kids are grown up now and I'm so tired of just reading books and hanging around. Is there something I can do to volunteer? That's such a beautiful thing to do. This woman recognized that she's got so much to give. She was in her mid-60s and she said, I want to help children. I want to help people. So give me, some ideas. And I thought, what a beautiful thing that's finding. She probably had a very meaningful life up until then, raising children. How much more meaningful can that be? And working full time and raising a family and juggling everything. That's amazing. And now she's in a different phase and she's ready to switch the kind of meaningful she's going to do. Okay, so there's a bunch of questions here. We're going to go through this briefly because our doctor's online now. So this is what you might want to ask. Things are a little more integrative now. Okay, we're combining, the idea that the physician knows best, which he does, and she does really because they're educated. So just remember that. But also they want you to be engaged in the care. They want you to take responsibility. And so many of them want to work with you. You would believe that so many would prefer you to take more responsibility. Please, they don't want to do everything for you anyway. There aren't these bossy types around here that want to tell you what to do. They do know better in terms of their educational abilities to make advice about things. But they really want you to take like more even upper hand in your healthcare. So you can decide these together with your doctor, and briefly again, because Dr. Shapiro is ready. So are you willing to work with me as a partner in my health? This is what you'll ask. What is your point of view about nutrition and health? Doctors are getting a better education now, and if they don't, they're trying to work on finding you the right person. Just like I will find you the right person. If I can't handle your problem, I'll take you to a doctor, I'll take you to a nutritionist, and I'll refer you. Not one person can't do everything always. What specialist should you go to? So do you want to do this in partnership with your healthcare provider? You want to make sure that you can get copies of your tests. Any doctor or a hospital or healthcare plan that doesn't give you access to your information, I think I would leave, because it's not fair. Because you might want to go to a different specialist, and you have to have all your information. You can't start from square one. It's too expensive, and it's too much. It's too costly, and it's too much time spent. So if I don't have another question is, if you don't have symptoms, how are you going to help me stay healthy? So you want to work out a plan together on how you can preventative care kind of a thing. There's a couple questions here I don't agree with. Food allergies, maybe they can help you with this. How can you protect the brain from injury, and aging kinds of questions. Elderly people are going to want to know, how can you help with arthritis, asthma, sinus problems, anything chronic illnesses? How much is your doctor going to be involved in this, or your healthcare provider? What can you recommend for high cholesterol? You want to know all the different things that people, there are different opinions on things, and you won't always agree, okay? But you should know that, again, you find the person that you can really connect with and who's very educated and very experienced, and they really want to help you get well, okay? But it is a partnership, so don't forget that you have to keep yourself healthy, and you have to take your own responsibility for this. So without further ado, I am going to get Dr. Shapiro coming on right now, and here he is. Let's see, let me get rid of my, I'm going to get rid of my screen. Hi, Dr. Shapiro, are you with us?
I'm with you. Nice to be with you today, Judith.
Thank you very much. I'm so glad that you're here. And I want to tell our our viewers a little bit about you. Okay, and you wrote it to me. I'm going to read it right now. Okay. Yikes. All right, this is Dr. Cynthia Shapiro. He now lives in Israel near me. He's a friend and a neighbor and a colleague. He is U.S.-trained osteopathic physician who has been practicing family medicine for the past 20 years and is presently in practice in Israel. He currently works with Leumit Healthcare Plan. I'm sorry, dry throat today. Is a family doctor and a director of palliative care medicine. So welcome, Dr. Shapiro. How are you?
Thank you so much. Doing well this morning. Doing well, Baruch Hashem.
Good. I'm going to take a sip. I said my bracha earlier.
Have a little coffee too. It's good.
Yeah, have your little sip. So, Dr. Shapiro, I don't know if you heard the first part of my my preamble to this, but I was telling people about how the evolution of the doctor-patient relationship and the healthcare provider-patient relationship, and how it has evolved from something which is we're very paternalistic to now it's much more equal in a lot of ways. And I want to know what your opinion is, first of all, about this evolution, and also what are your expectations of yourself as a doctor for people, and when they come to you, or their family when they come to you, and what you expect of them. And that's a lot to say, but you can just talk freely.
Okay. Well, I mean, Yotis, there's no question that the doctor-patient relationship has evolved over the last number of decades as information has become far more available. Not only the information in the sense that patients have electronic access to most of their medical records, which definitely is a game changer. But in addition, with the internet available, patients come in with far more information about their medical conditions, and sometimes far more misinformation about their medical conditions or what they're expecting. Because as we know, the internet is filled with lots of information, some of which is accurate and some of which is not accurate. In addition to that, you were talking a lot about choosing a healthcare provider. And I think a healthcare provider is very much a matchmaker type of process, in that there are many different perspectives to providing healthcare. And it's important for people to find a healthcare provider who feels comfortable for them and feels like a good fit for the kind of perspective that they want to have on their healthcare. Some people like to be more involved. Some people like to be less involved. Some people like more more complementary medicine, more integrative medicine, and other people like a more Western medical approach. Some people are like a more assertive approach, and some people like more of a hands-off approach. And these are all stylistic differences, not a matter of right and wrong. And different practitioners are going to have different styles, and those styles need to be matched with the patients who are best appropriate for them. So, but why am I saying that? Because we were talking about information on the internet. Well, the same thing is true of the information on the internet, except that when you read a web page about something, you're not necessarily aware of the perspective it's coming from. And people, when they write things on the internet, tend to write them as facts. This is just the way it is.
Yeah.
And from that perspective, that may be just the way it is. But it's usually when things are presented on the internet, they're presented very much in a one-sided perspective, not in an open perspective, particularly as our world has become more over time. So
well, it's like the news out there. You're going to get one side.
Absolutely.
You're not getting a debate. You're getting their opinion, like you said.
It's very representative of what's going on in the world at large. And so I would say people just should be very careful if they read something and it feels like that rubs them the wrong way. Well, go look somewhere else. That's probably not the right place for you to get information. So you were asking about, people coming to their doctors being more informed. So I have a lot of patients who come to me, and one of the things that I would say is it's very important to remember what the role of your healthcare provider is. And that while it may seem, like you said, equal, at the end of the day, it isn't. Because your healthcare provider is your healthcare provider because they've gone through many, many years of schooling and education, and they've gone through very rigorous licensure processes, and they've gone through thousands of patients if they have experience, maybe tens of thousands of patients if they have a lot of experience. And you're coming to them because you want to get their advice. Presumably. There are patients who come to their doctors because they want what they've researched and they've decided they want it already, and they want the doctor to just write it for them. That is not a healthcare provider who you're really going to be able to, we call them rubber stamp people, yes? That's not somebody you're going to be able to find as a partner for you. Anybody who's willing to work with you as a partner and helping you to develop something for your own health is going to need to feel like a partner also from their side in your healthcare. And therefore, if you see something on the internet that you're curious about or that seems to you like might be a concern to you, so I'll give you an example of two different ways to come into a healthcare provider and how it will radically change the type of relationship you'll have with your healthcare provider. Somebody searches on the internet, and based on the symptoms they have, looks to them like they have a thyroid problem. Okay. They come into their doctor, they make an appointment, come to their doctor, and they say, I'd like blood tests to check my thyroid, please. They've already decided that they have a thyroid problem, and this is the best test. I have this happen to me all the time, by the way. I've talked with a friend who said, I have a thyroid problem, and so I want to check out my thyroid. So what I usually do with people is I say, okay, maybe, can we back up a moment? Why don't you tell me what's going on with you? How are you feeling? What leads you to believe that you might have a thyroid problem? Why do you want to check this? And then people say, well, I'm tired all the time, and I just don't have as much get up and go as I used to have. And I think maybe I have a thyroid problem. Say, could be. But there are a lot of other things that could also cause that. So I'm going to check that, but I'd like to check some other things too. And then we start our partnership. And that's how it can really happen. Opposed to somebody who comes into me right off the bat and they say, I've been feeling like this, and this, and I've done a little research and it seems like it might be such and such a problem. What do you think? That person I know is already my partner. We can work together and we can figure it out.
Yeah.
And some people I need to more intentionally invite them into that partnership because they're not necessarily on that wavelength. But doctors, as there's more information out there, people very often view doctors as the vending machine, whereas it's just a poor use of resources. You have somebody there who has a lot of experience and training. Use them. That's what we're here for. We're here to help people. We don't get any fulfillment out of just being a rubber stamp. We're here to help people. We want to help people. So please use us for what we're here for. Yehudis, I just want to comment on something I caught at the tail end of when you were talking, and that's that you talked about being a practitioner and knowing your limitations, knowing that there are things that you can treat and things that you want to that it need to be referred out and addressed by somebody else. I think that's wonderful, and it's one of the things I love about Yehudis, and it's one of the reasons I send people to Yehudis. It's because she knows what she's good at, and she knows what's outside of the scope of her practice. I don't say that because Yehudis is an acupuncturist. I don't say it because Yehudis is a nurse. I say it because Yehudis is dealing with people. And I think it's as true of the biggest specialist, the biggest medical specialist, as it is of a massage therapist, an acupuncturist, a naturopath, a family doctor, anybody you're going to for healthcare. In my mind, one of the most reliable signs that they are a good practitioner and that they're a responsible practitioner is that they have a clear picture of what they can do and a clear picture of what they can't do, when to refer out. Somebody who doesn't know when to refer out will end up hurting somebody at some point because they'll think they can take care of something that they should have sent to somebody else. And it doesn't matter what kind of practitioner they are. And we need a little bit of humility. I'd say a lot of humility to be able to responsibly help people who come to us, because we're very, very finite, limited beings, even the smartest of us. And knowing when to ask somebody else for help is one of the most important things in any helping service, and particularly in medicine, because the stakes on the other side, if we make a mistake, are so high.
Yeah, I agree with you 100%. I felt like that for so many years when I worked with, I've seen surgeons who would say, I'm brilliant and I can do that kind of thing. And I think, or they would send people away and they can't help you. And I'd say, this is where I got into my quest for learning more about how to help people, is that I wasn't an earth mother. I said this at the beginning. I wasn't an organic grower and made my own baby food, nothing like that. I was healthy because I was a nurse, so always had vegetables everywhere. But and we had good health habits. But I didn't start thinking about where people can go for more help outside of surgery and medicine and surgery. This is because patients would come to me and say, I'd say, well, what are you doing about your dry eye? What are you doing about your insomnia? What are you doing about your irritable bowel? And this, my doctor told me to go home and live with it. I'm like, no, that's not okay. And I think this is the biggest change that I'd like to see. And I've seen that, in the healthcare professions, is that people, especially here in our area, I think it's much more available to find a physician like you who will really listen to the person and say, okay, let's look at some other ways you can treat yourself. Let's think outside the box. Maybe you should go see a nutritionist. Maybe you should go to an exercise therapist, or you should get a massage, or you should do Reiki. I mean, I don't know if you refer any of these things to people, but I'm just saying there are things that we can suggest to people, and that also gives them a lot more confidence in you as well. I think is that you're looking for a solution for them. I can't help you, but I know that Dr. Shapiro can help you. I know that he can. So go to him. And so it's you have to get rid of your ego and say, or to some degree. Because it just hurts when people leave you. Oh, I went to so-and-so chiropractor. I heard that all the time. I mean, I'm very good with back pain, most by and large. But I've had many people say to me, I went to so-and-so for chiropractor. I'm all better now. After they went to 10 treatments with me. And I'm like, okay. I have to get over that. It's like, I know I helped them all.
There's no one person who is the right match for who's going to be the right emissary for everybody. And I think one of the most important things a healthcare practitioner is just to recognize that even if it's something that I regularly treat and have a lot of success with, a lot of success is not 100% success. Nobody has 100% success with anything.
I was going to ask.
Even when I was working in hospice, we might say 100% of my patients died, but even that wasn't true. I had patients who I sent back, and that wasn't success. But it was success when I got to send them back to the community because they didn't die. That was sort of a joke in the in the field.
Oh my goodness! Listen, that one last thing I want to ask you before we close up, because I know you're a busy man and I got to get to work also. Is that how has your image of health evolved in your own life now? Like you went to medical school. I'm sure you said 20 years ago, or within 20 years, and now I for sure have become much more acutely aware that preventative is so important, and the health lifestyle and what we're eating and what we're doing. This is what I want my people to come with. I want them to take responsibility for that part of it, because part of getting rid of that paternalistic way of treating people is that, like, they have to take responsibility. I say that right up front to people. I say, you need to go home and do not what I say because of me, but go home for your own sake. Go do these healthy habits, things that we list a million times, and you see it all over the internet as well. Do you put those expectations on your patients, and would you like when they come to you with like a healthy mindset? Like, I'm sure you must, right?
I do, and I like it. Listen, I like it when I have people I can work with at the end of the day. I just had a patient come in to me yesterday, and they say, "I'm so sorry. I'm coming in and bothering you all the time." And I said, "You know what? I'm always happy to see you. Why? Because when you have an issue, you are looking at it, you're looking for ways to make it better. And then you come into me and we talk about it and we come up with something that's going to work for you, and then you do it." I have plenty of patients who come in and they come in all of the time and they complain, but they're not interested in doing anything to change the situation. Those are the patients who are frustrating for me to see all the time, because I've already told them everything I can say and they're not interested. So why are you coming back? Sure. People, there's no question that the background, the background basis for our life and our health, our physical health, our emotional and spiritual health, our mental health, is our we may not like the fact, we may argue with the fact, but at the end of the day, all of that spiritual, emotional, psychological things, it needs to work with a body. There's a body that actually takes you around this world, and it's the vehicle that allows you to do stuff. So if you don't take care of it, just like if you don't take your car for regular tipulim, for regular maintenance, you don't put gas in it, you put garbage in it. If you put a taffy in your car, it's not going to work very well for very long. So the fact that our bodies are made in such a way so that, particularly in our younger years, it's very forgiving and has an incredible ability to overcome the most phenomenal abuse that we do to it, does not mean that that is unlimited. And we taking care of ourselves, ensuring that we have a proper a proper organization to our day, that we go to sleep at reasonable hours, that we eat at consistent times. I think it's important that we think of our body. I always tell people, your body is kind of like your donkey. In the old days, people would take their donkey from here to there. Yes, and that would be that was their car, that was their vehicle, that was their way to make a living. It was so many things for them. But if you don't feed your donkey on time, it gets ornery and irritable and doesn't do its job very well. If you don't let give your donkey a reasonable place to sleep and let it sleep at reasonable times and push it too hard, it's going to get irritable and not do its job very well. Our bodies are the same way. You got to treat it properly. You got to take care of it. And that means good diet and exercise. You haven't asked it to me yet, Yehudis, but I think it's an important point. You sent it to me beforehand, so I'm going to preempt you, and I'm going to ask it myself, which is that, I see that a lot of people try to make changes in their health habits, They want them to be sustainable changes, but they're just not successful in doing it. And I see one of the biggest challenges to that are that people oftentimes try to make extreme or large changes. We don't do very well with extreme or large changes.
Right.
As human beings, we are built from the bottom up for consistency. And consistency gives us the best results. That means going to bed at consistent times, eating at consistent times, but making large changes, we're not very good at them. They tend to burn us out. So what I tell people is try to get the most bang for your buck. So I want to give you some concrete examples of that.
Okay.
Let's say that I'm meeting with somebody who wants to make some dietary changes, and we're talking about cutting back on their sugar intake or their carbohydrate intake. So I asked them a few questions. What are the big ticket items that you have a lot of during the day that you would say is most of your sugar or what white processed flour intake? Usually there are two places that I hear people say. It's either soft drinks. They drink a lot of soft drinks.
Mm-hmm.
I'll throw in with that coffee. Sometimes people will drink, 18 cups of coffee a day with, 2 spoons of sugar in every one and milk. That's a lot. Forget about the caffeine part. Let's just put that on the side for a minute. Just from the sugar.
I'm drinking echinacea tea right now. You should know because I have a little bit of sore throat, so that's it.
I drink my coffee black with no sugar. So
I like my coffee.
But that's a lot of sugar. So soft drinks. A lot of times people drinking a lot of soft drinks during the day, even diet drinks. And the other place is cake. People will have different cakes and baked goods, and they have through the day, or they have for breakfast, or their donut, or whatever it is. Those are the two places that I tend to see people have the most. If they were to choose one thing that gives them the most throughout their day of the sugar and refined white flour. And so what I tell people is, you know what? I don't want you to cut out. We're working on getting better. What I want you to do is I want you to take the one largest source of intake of sugar or white flour, and I want you to cut it in half. That's all I want you to do for the next couple of weeks. Just cut it in half. Have half the amount of soft drinks that you have. Have half the amount of cake that you have. You should still have it, but have half. And people, they do that and they find, hey, that's really doable. And we may have gotten a 30% improvement in their overall intake in one shot without them feeling deprived in any way, shape, or form. That's something you can keep up. As human beings, shooting for 100% is shooting for failure. We live in an imperfect world. To expect from ourselves 100% means at some point we're going to have to come to terms with the fact that we're imperfect, finite human beings. Shooting for making the biggest difference we can make with the amount of resources we have, that's a good place to invest. You get a lot of bang for your buck with not a lot of investment in cutting down 50% of those things. And so that's what I look for. And after we do that, I go for the next one. After we do a few of those, then we can start to fine tune it. But that's where you really get big changes without feeling like you're burning yourself out and you're depriving yourself.
Great advice.
And those are the kind of things that I think can really last over time.
That's great advice. And what I do, in addition to that, I sort of surreptitiously behind the scenes send them things to read. Just read this. Isn't this interesting? Why don't you read that? And it doesn't say, everything's evil. Like I just sent out I started a WhatsApp group that I wanted to tell people about. It just talks about interesting things I've learned about, healthy eating. Just interesting things I've learned. Maybe you'll find it interesting too. And there's a doctor named Dr. William Lee out there. I'm a big fan of his, and he's a nutritionist and a physician, and he's a scientist, and he cares all about heart health more than anything. But he started investigating foods, and he's come up with a list of foods that are so delicious and healthy and wonderful, and he does the scientific research on them. And so he comes to the components of them, like why are they really helping us? And wow, isn't that interesting? So instead of saying don't eat your sugar and don't eat your donut, I said, look, if you eat mushrooms every day, Mushrooms are anti-inflammatory and antioxidants, and I love mushrooms. I actually do eat them every day, and look at how I'm doing something I didn't even realize is so healthy for myself. And if you don't start incorporate, so that's my way of getting to people too, is like surreptitiously under the radar, slipping a lot of information to them that they can make their own choices then too.
I think that's a great idea. And I'll put one more on there, which is the follow-up appointment. I find one of the biggest helps for us is we get motivated by knowing that, number one, somebody cares about us, and number two, that we're going to have to report to somebody. It's human nature. It's not personal. Doesn't mean you're a bad person and you're totally unmotivated. Totally not. I'm the same way. Everybody knows the same way. At the end of the day, if I send somebody away with the advice that I just suggested of, say, cutting down their cake intake or their soft drink intake by 50%, and I tell them, let's meet next week. So what'll happen is the first 2 days, they're more likely to do it. Right. And then they're going to start to lay off a little bit. And then about 3 days before their appointment, they're going to say, "Ooh, I'm going to have to meet Dr. Shapiro, and he's going to ask me, what am I doing?" Or I even tell people, I say, "I want to meet in a week, and I'm going to ask you how you're doing with this." And so people a few days before, "Oh, I better get back on it." But that's the way we are. That's what we are. Sometimes, that's why follow-up groups or
accountability,
your healthcare practitioner can be so helpful. Or even, sometimes I'll send somebody an email or WhatsApp, and I'll just say, "Hey, what's going on with those dietary changes we discussed?" Just helps to kind of get people back on, not in a judgy kind of way, just in we could all use a little bit of extra support.
That's extra support, but also I'm telling you this not to reveal anything personal like that seems too personal, but I have been so involved in getting people to healthy eating, and I'm having trouble with it myself. So I just spent a lot of money. I did a lot of research, and I joined with a health coach for myself because I want accountability from me. Because it's easy for me to say, yes, you should do this, but yet I wasn't really able to do it for myself, which is very typical of healthcare providers in general. We had a good conversation about this. She said, you're a typical healthcare provider and a typical mom and a dad. You take care of everybody else and you leave yourself for last. That's really what it's a lot about for me. So I don't leave time for my own self, but that's going to be part of restructuring how I'll take care of myself. But sometimes you got to pay some money, and sometimes you have to have somebody to be accountable to, and that's what I've just made my commitment for. So I'll let you know how that goes. And thank you so much for joining us. It's just amazing to talk to you, and I'm sure that people will get so much out of hearing your advice and knowing that people like you are out there to care for us and give such wonderful suggestions, and you're kind, and you're there for the duration, and we need more people like you. And thank you so much for joining us. And
thanks so much,
afternoon. Okay, bye everybody. See you next week. Bye-bye. I'm going to end the broadcast.